Choosing a contraceptive, that is how you will counsel your patient about the approach to choose the appropriate method. So there is a process how you counsel your patient. Contraception counseling process. Number one, very important, establish rapport with your patient, maintain confidentiality and privacy. Establish rapport with your patient. Second, identify those appropriate to receive contraception counseling. Not everybody would want to look for contraception, but it is an opportunistic method. Any woman coming to your OPD with any other complaint, do talk about contraception. What contraceptions are you using? So identify those patients who are actually looking for contraception and would want to accept and listen to your contraceptive buck there in the OPD. Assess thorough medical history and contraindications to any methods that you would want to talk about. Next, initiate contraceptive counseling process. Initiate the process of counseling. Elicit informed preferences that the patient might have. She might come directly sunke ki meri bhabhi ko ye suit karta hai, please put this for me. So do understand where are the patient's preferences, whether she wants a permanent method, whether she wants an LARC, whether she's an infrequent person who has intercourse, she might want to opt for less regular methods. So elicit informed preferences for method characteristics, facilitate her preference, and have a concordant decision making. Counsel about method initiation and the usage of method. Initiation and use. Many PG, especially if you are in a hurry in the OPD, you will sit and tell Mala and Khalo. Some medical colleges write Mala in 21 days. You will never be able to counsel the patient. Start on day 3 or day 5 of your menstrual cycle. This is how you are supposed to use. Then the next 7 days you have to take those iron tablets, and then again leave it for some days. Again started from day 3, day 5. You'd never barely even get time to talk to your patients, right? So what would be the approach? You can have a structured questionnaire to discuss with your patient where you want to ask about the reproductive. So WHO and CDSCO, like CDC, tells to talk about. They have given this approach. The name of the approach is a reproductive life plan. How many children she want to have, whether she's using this as a spacing method, whether she wants a permanent method. So these are the questions that you might ask. What is a reproductive life plan? You can ask, other than that, the other method is called as a one key question. One key question. Third method is screen the woman for need of contraception counseling. CC is contraception counseling. Then there is a very important path questions. I was once asked, what is path questionnaire? Not in my exams, of course. Path questions. What is path? Can anybody tell me? Has anybody read before coming in today's lecture? So it is nothing but pregnancy, attitude. Sorry for my bad spellings there. Pregnancy, attitude, timings, how, PATH, how important is pregnancy prevention. So these are the methods of counseling, which was a little boring and dry to talk about in the initial. Then I told you I would want you all to download in your phones the WHOMEC wheel, or have it in a hard copy. You can ask any of the medical reps who come to you ki medic wheel de do ek. Keep that with you for your lifetime. Now, let's start talking about each individual new generation methods that are available. Number one is next generation contraceptive vaginal rings. So, intravaginal, can you name any of the IVRs or intravaginal rings you know of? Which can be used for 3 months. Second, you have Nesteron only vaginal rings. You have Ovaprene, which is a monthly vaginal ring. Clear? Second is biodegradable contraceptive implants that are available. So very interestingly, Bill and Melinda Gates Foundation is sponsoring the studies in all kinds of contraception that is available, and it is one of your probable question. One interesting thing I would want to tell you. So AIMS UGs rather have a very big advantage. Every AIMS undergraduate gets a funding of minimum of 50,000 tenure, like during their entire MBBS, to do one kind of research. And Bill and Melinda Gates Foundation researchers is what they mostly look up to, and I'm sorry for that. And then they do get sponsors and funding to do researches. It is like every year we have these things which are discussed. There is a meeting with the director where they, students get their proposals, the MBBS students. It's so interesting. It is very inspiring rather. I've attended one such meeting where they would get their proposals, and not only MBBS students, I've seen even those OT technician ka course karne jo aate, the BSc courses, they come with such brilliant proposals. There one point of time there was a proposal of all AI projects which was to be funded by ex-AIMS people who are currently working out of India. The entire projects were getting sponsored. There were actually people who were sitting ready to sponsor. The moment they liked their projects, their research ideas, okay, I'm putting in this much for your research, go ahead with it. So it is inspiring in a way, you should think about novel methods, novel technologies, about how things can get better in medical sciences. You can collaborate if you have an IIT nearby. You can collaborate with any of the IITN who's doing biotechnology or biomedical sciences. They are doing any kind of bioengineering projects. You can collaborate with them and give your ideas. This is what we need. This is the place where medical science and gynecology is lacking. Please use your brain. Please use your technology and come and help and work with us. So Bill and Melinda Gates Foundation sponsors these contraceptive implants. One such is CESAR, which works for 18 to 24 months. This is one of the biodegradable contraceptive implant. Then you have micro needle contraceptive patches, which I have already shown you the image of, or they are also called as micro array patches, which are nothing but band-aid like patches to use. Then there are LARCs. LARCs currently are less recent. You have the biggest LARC, that is Mirena, which has come up. Now the new advances is happening in DMPA contraceptive injection. Initially, we know the DAMPA was introduced in 1992, but currently FHI 360, that the poster that I have shown you, is currently conducting more researches into contraceptive LARC implants and contraceptive injectables, which can be self-injectable by the woman. The woman does not need to go every month, and they are trying to get 6 monthly DAMPA self-injectable contraceptives. So this is a newer development here. Coming to the core of the subject now, this is where the real lecture starts, that is dual use technology, where we will talk about the dual use pill. So there is something which will have an oral pre-exposure prophylaxis with HIV plus a already established COC contraceptive pill. This has been combined in one single tablet, which can be taken on daily basis, which is the either the example of one such tablet. It's not a tablet, the vaginal ring, which has come in the dual use technology, is dapivirine, which is an antiretroviral drug combined with LNG in a vaginal ring, and this combination is about to be introduced in the markets. So what does this dapivirine and LNG ring looks like, and how does it work? Let us have a look. So here, this is actually a 1 month ring which has to be replaced on every monthly basis. There are other drug releasing systems which could be non-hormonal vaginal rings you have, where dapivirine is available with non-hormonal inserts. Other than that, you have non-hormonal fast dissolving vaginal inserts. So why there was a need to introduce new formulations? Why we were frustrated with the common estrogen preparations? So we all know there were estradiol, which is E2. Then you have E4, which is tetrol. Then there is ethinyl estradiol, which is most commonly present in all contraceptives. Any COC that you Novilon, Thalon, Mala and Maladi, everything has ethinyl estradiol. E4 salts, because they had decreased venous thromboembolism risk and decreased hemostatic changes as compared to ethinyl estradiol. Then secondly, even the progesterones were introduced in new formulations. Why new progestins were needed to be introduced? Because we wanted progestins which have less side effects due to less androgenic activities. So that was the need to introduce new formulations with better estrogen preparation and better progesterone preparations. Coming back to your Nesteron ring, what does this contain? This basically has a formulation of estradiol and not the Nuva ring wala ethinyl estradiol nahi hai. Isme it has estradiol plus it has segesterone acetate. So that is a progesterone which I already introduced to you in the class. It is a in the previous slides. It is a potent progestin. It has no androgenic property. That can also be available as progestin only patches. Can you tell me, when we saw the segesterone essay का slide, I told you कि इसका क्या property है? It cannot be taken in oral form, इसलिए किसी COC के साथ combined oral pill में नहीं available. It can be used as patches, as vaginal ring, and very interestingly, when the people thought कि हम जब इसको estradiol के साथ combine करके दे रहे हैं, E2 plus SA is nothing but Nesteron. So I remember this as NASA. This is only for you to remember. Nesteron ring has E2 and SA. E2 and SA, NASA. So that is how I was remembering. Then there came suggestions. Why don't you give this as a progesterone only vaginal ring? None of such progesterone only vaginal ring, which is called as PVR, was available until the introduction of segesterone acetate. People felt that this could be given to postpartum lactating women So it was of benefit in postpartum breastfeeding women. It is a donut shaped, soft, flexible silicone ring which has a diameter of 58 mm outer dia. Please take this down. I've got these information from for all of you from very different varied sources, and it's very difficult to get it combined in one place. I think it's been a couple of weeks that I have been doing R&D for this lecture. So 2.4 mm is the contraception cross section, contraceptive rings cross section, and interestingly it releases 2 gram of micronized progesterone, releasing approximately 10 milligram per day of progesterone vaginally.